1 year ago, AAPM&R launched a landmark call to action. The world was wrestling with the impacts of COVID-19, and a new crisis was rising: long COVID. To combat this crisis, AAPM&R called on the administration and Congress for a comprehensive national plan to meet the needs of the millions of Americans with symptoms. We know the impact that PM&R-led care can have when PM&R physicians direct rehabilitation and recovery. As team leaders and problem solvers, your training and medical expertise is essential to caring for patients suffering from long COVID, as well as other disabling conditions and physical impairments. Driven by our mission to lead the advancement of PM&R's impact throughout healthcare and our vision for the specialty through PM&R Bold, AAPM&R's goal has been to establish the expertise of PM&R physicians, increase access to rehabilitation care, and become a go-to resource for rehabilitation leadership. And now, our efforts are paying off. Patients suffering from long COVID are being prioritized by the administration. 1 year after our initial call to action, there is a new national COVID-19 preparedness plan, including a directive from the President to the U.S. government to accelerate efforts to detect, prevent, and treat long COVID. We're also working closely with offices across Capitol Hill, resulting in newly introduced legislation in Congress and demands for attention and funding to address the long COVID crisis. AAPM&R continues to advocate that this action lead to increased support for rehabilitation care. How did AAPM&R lead this call? By showcasing your expertise, by positioning PM&R as leaders in healthcare. From the very start, AAPM&R's message resonated, but we knew it would take more. So we gathered PM&R physicians and their colleagues into a PASC collaborative to create multidisciplinary guidance. Our health policy team has worked directly with the administration staff and Centers for Disease Control and Prevention, sharing our findings and advocating that more needs to be done. The administration has supported our efforts and invited us to share our guidance with clinicians nationally. And Congress has called on the expertise of PM&R leaders like Dr. Monica Verduzco Gutierrez to testify to the needs of this patient population. AAPM&R also launched the country's only long COVID dashboard to show the growing number of Americans who are estimated to have or had symptoms of long COVID. These numbers continue to grow as additional variants spread across the nation, and the dashboard itself has become a primary source for lawmakers and media, along with our multidisciplinary guidance. And finally, as we have gained a new seat at the proverbial table, engaging in health policy work to find meaningful solutions for patients and providers, we are also working to ensure that you, as a PM&R physician, are seen as an essential medical expert and an indispensable leader early and throughout the continuum of patient care. Aligned with AAPM&R's specialty brand strategy, we've landed numerous exciting media opportunities in major national outlets including print, TV, digital, and podcasts, and we know that highlighting PM&R's physician leadership in patient care for long COVID will continue to demonstrate the value of PM&R to the healthcare continuum. To be a national leader, we are showing up to this national crisis. And our next step is to ensure that this work lays the foundation for increased understanding of all aspects of PM&R. The care you provide is essential, and we're working to ensure that this is understood across healthcare's biggest decision makers in order to make our vision a reality. Thank you to all our members who are working tirelessly through this pandemic treating long COVID patients, and to our volunteer leaders who have spent countless hours to advance these efforts. We have come a long way in 1 year. We look forward to the work ahead. To learn more, visit aapmr.org/longcovid.